Hello, my name is Helen and I'm talking to you today about some work we've been undertaking within Southern Health. We have always prided ourselves that we keep our patients safe, but we can always do a little bit better, we can improve continuously, and so we're here to focus now on the experience of our patients. We have an increasingly complex, frail, vulnerable population who are finding themselves in our wards for significant periods of time. And traditionally we've used agency nurses to make sure these patients are safe. But what about their patient experience? What about their therapeutic goals? What do we do about that? Actually, for us, we realised we didn't do that much. So we're going to show you three perspectives from the patient, from the nurse and from a family member about our development of Together in Care, which is a project around improving the experience of the patient, but also the family, but equally for our staff member as well, so that activities are engaged around the patient's well-being, their likes, their dislikes. It's all joined up. There's a continuity of care delivery that is shared across the nursing and the families. We do plan to roll this out across our 11 physical health wards, which is across 6 hospital sites, and so NHS Improvements and the tools that they've given us have helped us, or will be helping us, to make sure that across Hampshire the rollout is as seamless as it can be.
My patient's just arrived. I have the next 2 hours to begin getting to know her, making sure that she feels welcome. She looks really anxious at the moment. I use the hello my name is to introduce myself. The patient physically withdraws away from me, but perhaps later we can invite the family to be involved in putting her clothes on to normalise the environment for her. The patient begins to relax, reassured that her family will be involved in her hospital stay. Together in Care is all about working in partnership, making sure families feel included and are happy to be involved in our Together in Care approach. To reduce anxiety, I'm only going to use a simple booklet to introduce and explain the Together in Care approach. This explains how we can work together, ensuring the best experience for patients and families to anticipate the patient's needs. Other things include cognitive, physical and social activity, remembering the importance of quiet time and rest. Together in Care is all about the experience and engagement being as important as patient safety.
I hate hospitals. I don't want to be here. This is so confusing. Where are my clothes? Oh, what does that say? Oh, nice to meet you. Oh yeah, sit down if you want. Oh, please don't touch me. I don't know you. I bet she's going to ask my daughter to go now, and I don't want her to go. Oh, she says she can stay with me for as long as she wants. Oh, that's a relief. Oh, I'm glad she can stay. Oh, so this is about me and my care, and what will make me feel less anxious. She's explaining that I'll always have someone with me, I won't be alone, and I won't be bored. Oh, I like looking at photos of us. Oh, this is really nice. This feels less intimidating. She seems really friendly and interested in me.
Mum got admitted to hospital today. I can see she's really anxious. I'm actually feeling really anxious for her. Really can't wait for the nurse to get here. She seems really friendly. She came straight up to Mum, really good eye contact. I can see Mum's a little bit hesitant, but also I can feel her slowly relaxing. The nurse is being so supportive. And also the nurse is really great and introduced herself to me. Really good eye contact, and she's talking about how I'm going to be involved in Mum's care. She's also talking about the Together in Care approach and about all the activities we're going to be doing together to help support Mum. Turns out that we can book 2-hour sessions and we can have dedicated time with Mum. And also I get a purple lanyard where I get unrestricted access, so I can come see her anytime. This sounds really great. Can't wait to do the activities. We're just sharing memories at the minute, and I also get help with supporting personal care such as washing. Yeah, Mum's really enjoying it. I feel really confident now that when she's discharged we'll be okay.
We hope you've enjoyed our short video of how we're developing together in care. We are at the start of this journey and it will continue to evolve. The 3 perspectives we've given you today are where we believe the benefits should be. So for the patient, we would hope this means that their environment is less anxious, less confusing, more familiar. We would hope that we truly are socialising, mobilising and normalising our patients back to their place of admission. From a family perspective, if that is with them at home, that we've built their confidence in how they can better manage their loved one at home in a different environment, using some of the activities and skills that we will have shared with them. And for our staff, that they haven't got the burden of a 7.5-hour shift, that they're going to have 2 hourly slots on rotation, where they will have an activity-led programme in conjunction with family and patients to ensure that the day goes well for everybody. This can only help to improve the experience of all those mentioned, but also we're looking to expedite discharge home and make discharge less scary activity for our families. So thank you for joining us and demonstrating our 3 perspectives and for joining us in our journey together in care.